This is a Geisinger Medical Minute, featuring Dr. Sandra Culbertson, discussing menopause, symptoms, and treatment options.
Menopause is when our ovaries start to decrease the amount of hormone they make. When we talk to a patient about menopause symptoms, the one that everybody talks about and laughs about are hot flashes, right? How do you treat symptomatically, like the layers of clothing, having a fan nearby, staying in cooler rooms? Antidepressants can also help menopausal symptoms. As your estrogen levels decline, your bones start to thin, and this is where we start to worry about osteoporosis fractures. So exercise, making sure you're getting your vitamin D and calcium becomes more and more important with time. Hormone replacement therapy has kind of been the mainstay of treatment for menopausal symptoms. Many women are good candidates for it. If you're concerned and you have symptoms, talking to your provider, making sure the provider understands how much it's affecting their life. More and more providers are willing to have that conversation, and I think that's what the important thing is.